joining me this evening with Dr. Okwuchi Ogbonna.
Thank you.
We are going to be talking a lot about coronavirus and how to deal with that in the minority community. And as looking, we might be living with COVID for a little while.
Yeah.
So it is important that we know the proper precautions to take moving forward till a vaccine gets here, or even after a vaccine gets here, right?
Exactly.
So
Exactly.
again, if you're just joining us, welcome. If you are on Instagram and you have any question for her, please type it in and I'll read it out to her and she can see it herself too. If you have any questions on Zoom, you can, you're muted on Zoom right now. And I did that only because I didn't want everybody talking at the same time. But if you want to take your videos off, let me know. I'll take it off. But feel free to ask any questions that you have, okay? Again, my name is Obi. This is called The News with Obi, a platform where I talk about a lot of things happening in our community and around the world. We talk a lot of politics. Coronavirus is political, whether you want to believe it or not, or the way it's being handled is political, I should say. So the perfect person to join me tonight, Dr. Okwuchi Ogbonna, to talk about the coronavirus in the minority communities. Thank you so much for joining us. And Dr. Okwuchi, please tell us a little bit about yourself.
Okay. Thank you so much for having me. My name is Okwuchi Ogbonna, like you stated. I'm a board-certified family medicine physician, as well as a Master of Public Health with a focus in epidemiology. I earned my public health degree before I went to medical school. I always knew I wanted to be a doctor, but I decided to work on my public health degree from the suggestion of my older sister, who had actually earned her master's in public health at the time. She, told me to kind of do it, that it would make me a better physician, just kind of from what she had learned while doing her degree. So I'm very grateful for that. I think while I was doing my master's in public health, you learn so much about the other side of medicine that we as physicians don't typically see. In medicine, what we're doing typically is treating diseases, treating illnesses. In public health, you're focusing on disease prevention. So I think it makes me a well-rounded primary care physician specifically just because of that. One thing that's important to note is that I don't practice epidemiology on a daily basis right now, although I have a background in that. I do, however, practice preventative medicine on a daily basis with my patients. I do, on occasion, get the opportunity to practice primary prevention, but on occasion as well, but most of the time I'm practicing secondary prevention. So that's a little bit about my background. Also, right now I work in outpatient setting, and I work with a majority, over 90% of my patients are lower socioeconomic status, as well as of African American and Latino background. So that's just a little bit of my background. So
that's awesome. That's an elaborate background. I couldn't have asked for a better guest to be on the show. If you can do me a favor, your camera on Instagram, can you position it a little bit so we can see your face a little more? I know you're focused on Zoom. There we go. Perfect.
My headphone on the bottom is kind of disrupting.
It's kind of okay.
Yeah.
All right, but that's good. That's good. We can still see you.
Good. I hope it doesn't fall.
So as an expert with a background in epidemiology and public health, talk to us about the cause of the virus and how it has been affecting different communities.
Okay, that's a great way to start. So I think what's important to know is a little bit about the background and the nature of this virus, the COVID-19 virus. So the COVID-19 virus is part of a bigger group of viruses called the coronavirus. I think that's why we hear that COVID-19 and corona. The coronavirus is an umbrella term used to describe quite a few other viruses, including the virus that causes the common cold. When you have the stuffy nose, the sore throat, that's the common cold. It is a coronavirus. We also have other viruses under this umbrella as well, including the MERS that caused an outbreak in 2012. As well as the SARS virus that caused an outbreak in 2003. Now, it's important to note that neither one of these viruses caused anything close to the magnitude of what we're seeing today. What's important is, and I will talk about why this is important, is that the COVID-19 virus is of closest relationship to two coronaviruses seen in bats.
Okay.
And I think that kind of gives, credence to, can you mute whoever that person that's talking? So, like I was saying, that gives some credence to the hypothesis that this came from consumption of wildlife in those wet markets located in Wuhan, China. We do also know that the index case was from Wuhan. It was noted in Wuhan, China, at the early parts of December of 2019. We know that there are two different strains of the. Can you please mute the person that's talking? Is that possible?
I am. I muted them, and they I think is Emilio. Emilio, can you mute yourself, please?
Yes. Sorry.
Okwuchi, I'm sorry. Go ahead.
Okay. So we know a couple things about the specific virus itself. There are two different types. There's the L and the S type.
Please.
The L type of the COVID-19 virus is responsible for about 70% of the cases that we're seeing today. That means that there is another type of virus out there of the strain of the COVID-19 virus, but we're not sure what impact it's really having. And if that means that people that have already been infected with the L type, if they could still get infected by the S type, if it does become more rampant. So I was talking about transmission of this virus. We know as well that the virus can live on surfaces for a prolonged period of time, and that's important as far as like giving the recommendations to wash our hands, hand sanitize, and not touching our face and things like that. Just as far as where this virus came from, we discussed as far as being from China originally. We are aware that China has the largest population in the world. Second closely, India, and then the United States is number 3. China has reported so far less than 5,000 deaths, but the United States has reported over 56,000 deaths as far as late as yesterday. So it's kind of important to understand what they did differently, what we're not doing correctly. Just thinking about them having a much larger population than us, and we having 10 times their death rate at this point.
So I know that's kind of broad for everybody. I'm sorry about the interruptions we were having earlier on Zoom. But can we talk a little bit about how the coronavirus has been affecting minority communities recently? We know that the African American and Latino communities have been hit hard with the COVID-19. Can you tell us why that is? I think we kind of know why that is, but it's going to segue to our next question as well.
Okay. So you're right. We might know why that is, but it's kind of what do we do about it? That would be the most important thing to focus on at this point. But some things to point out is that data has shown that there are disparities in healthcare. It's telling me that you need to let me in again.
Sorry. There we go.
Okay. Can you hear me? Am I muted?
No, you're not muted.
Because it says that I'm muted. Can you hear me okay now?
Yep.
Okay. So we know that data has shown that there are disparities in health, and those disparities are based on race, ethnicity, and socioeconomic background. We also know that people that are born into poverty have a higher risk of developing chronic medical conditions, and those conditions include, but not limited to, lung diseases, asthma, we have hypertension, we have diabetes, cardiovascular disease, and obesity, which kind of coexist with all of these medical conditions. And they individually will increase mortality, but collectively, of course, will make mortality a lot more, it will make mortality worse. Just a little bit of a caveat, we know that African-American infants have a 2.3 times higher infant mortality rate compared to their Caucasian counterparts. So it almost seems like these babies are born without a fighting chance. African Americans almost don't have a fighting chance even at birth. It's important to know that socioeconomic status plays a big role in all of this as far as contraction of the virus. I was reading an interview done by Dr. Cooper from the Johns Hopkins School of Public Health, and she mentioned quite a few things that we may think are common sense things, but they in fact are evidence as to why the African American and the Latino, the lower socioeconomic minority communities are getting ravished by this infection. Some things that she pointed out were transportation. Now, when you think of transportation, somebody that's of a lower socioeconomic status may not have the ability to have their own vehicle, and they depend on public transportation. Now, they get into a bus. It's harder for them to practice social distancing, right? It's easier for them to come in contact with the surface that's been contaminated, and in essence, contract this virus. So that's just one thing to think about. Other things that were mentioned include access to healthcare. Now, I said I work in primary care and I work in a lower socioeconomic environment. Right now, I'm the only full scope physician in my office. There are other providers in my office, but I am the only full scope physician, which makes, begs the question, why are we not having more physicians in these neighborhoods, and why are they not staying in these neighborhoods? We also know that there's poor health literacy in the African American community. There's not always that understanding that the foods that we're eating, the cigarettes that we're smoking on a daily basis, have a direct correlation to disease formation, worsening of diseases, and eventually mortality, increasing our mortality.
But knowing what we know now, how can we go about actually being safe moving forward? Like I mentioned earlier, it looks like we're going to be living with COVID for a little bit.
Right.
So in the minority community, we've seen people still not social distancing. We've seen people still hanging out at the park as if nothing is really going on. I'm talking about in clusters. A few days ago, I saw a video about a house party in Chicago, and it was packed, like really packed. So what do we need to do moving forward to really protect ourselves from this? Because we don't know if there's going to be a second wave. People are still dying from this. There's no vaccine yet. So talk to us a little bit about that.
So I think it's education at the end of the day. There has to be a receptive nature from the people that are being told these things, from the African American population, from us in general, right? We have to believe what we're told. We're not, we may not see the direct effects because our family members are not, our direct family members are not dying from the disease, but these numbers are real. They're not like statistics. They're not like made up figures. They are real people dying. So it's just awareness. It's just education. And I think if we do a better job at educating, how we can do that better, I don't know, because I think from all of the news channels being inundated with COVID-19 pandemic, and some people still choose not to listen. It's difficult to understand that. And I think that's also important to know that there is some stigma, the lack of trust for authority, in the African American community, where we feel, okay, we don't trust what they're saying to us. Oh, this disease is not affecting us. There was a lot of that initially, until we started hearing people coming on TV and on social media and saying, "Oh, I contracted the virus. I'm a Black person."
At first, we were bragging about how it didn't affect Black people.
It didn't affect Black people. Exactly. Right. There was definitely that notion. Yeah. So it's important to just educate ourselves. Really,
and somebody on a Kmo on Instagram is saying socioeconomic status plays a huge role in health status as well. And we've known that there's been health disparities. It's just that, like Dr. Fauci said, this coronavirus is shedding more light on it at this point. So knowing what we know, that the health disparities are there, is there anything that you can advise us on what to do to be healthy moving forward? Before you do that, also, let me, somebody said, then come and find out they discovered it affects minorities more. So they're pretty much agreeing with what you've been saying.
Absolutely.
Yeah.
So I think it's a little bit difficult to say like it's affecting minorities more. We don't have a genetic predisposition to contract COVID-19. It's the morbidity, it's the illnesses, the chronic illnesses that we have that are higher in the lower socioeconomic, that are higher in the minority communities, that increases our risk of dying from the disease. The reasons why we are having a higher rate of contracting it, is now the socioeconomic aspect. We're contracting it because we're living in clusters. Lower socioeconomic people have more, they have the higher tendency to live in close quarters. There are multiple families in one home. You can't tell somebody that has a virus, go home and socially isolate. They have family members that share a bathroom with them. It's impossible for them to do that. You have essential workers as lower socioeconomic people, like the gentleman that died in Detroit, Jason Hargrove, I believe was his name, the bus driver that, he was driving a bus and just said a passenger came on, coughed, and he eventually contracted the COVID-19 virus and succumbed to his illness. So it's not so much that we have a genetic predisposition. It's not affecting us more in that it's like, it has a genetic pull to us. It's just that we are in this disadvantaged situations that causes us to get this infection more.
Right. Well, and I want to mention something too. Body Designed by Kareem and Michelle live both ordinary. They're both my trainers. And Body Designed by Kareem, he actually sent me a video this morning about somebody was talking about how the blood groups that really get affected by COVID. So they were saying people that are more of an old blood type, they and there's not enough research to support this, but people that are of a more old blood type don't really get affected much compared to if you were A, B, or A, or something along those lines. Again, there's not enough research, but I don't know if you have anything or you can shed any kind of light on that.
So I think my follow-up to that hypothesis would be, is there less of O blood type in the African American population? That would be the better question to ask.
Well, they were saying there's more of an O blood type in China, but they seem to have contacted it more, and the person in the video was saying that whatever that we're hearing from China is fake news. He had no basis. At least not enough, but it's good that I brought it. I wanted to bring this up today. It wasn't part of what we were going to discuss anyway, but I thought it was important to know or to bring that up, or if you have any input towards that.
I don't know that for sure, and I think that's a lot of the information that we have right now is just kind of like from short case studies and preliminary studies. That's not how typically medicine works. Science is based on evidence and vetted evidence, basically. Right now we don't have vetted evidence, so we can't speak with certainty about things like that.
Well, Kareem is saying on Instagram, he's saying, and you can see it too, he's saying the Jewish community is still not social distancing and they're not dying as fast. Proof that our health is the main cause of our deaths.
Absolutely.
Yeah.
And I think that's absolutely true. We have higher rates of diabetes, hypertension, cardiovascular disease, obesity, asthma in the African American and Latino population. So there's no mixing that up. It's absolutely health related. Absolutely.
Yeah. So let me ask you this. Governor Cuomo of New York, you guys, people that don't live in New York, sorry, we have a good governor, but he's rolling out the antibody test in an effort to help to decide how quickly the state should open back up. So my question to you is, if one has recovered from the virus, does that make the person immune?
So that's a great question, and I'm going to start by saying that we're not 100% sure. We do know that serology testing, basically that's when you're taking serum or from somebody that has is or has recovered from the illness, this convalescent patients. We do know that antibodies take about anywhere from 10 to 15 days to form. These antibodies are a protein that are formed when an offending agent is encountered by the body. So we have antibodies to a lot of things. We form antibodies when we get vaccines, basically, so that when we do get exposed to an infection again, we mount a response quicker than we would have if we've never experienced the infection. So we know that these antibodies take time to form. What we've seen now, though, is that these antibodies that are taken from previously ill patients given to people that are newly diagnosed with the infection, it has shown some promise that it decreases the severity of the illness and decreases the duration of the illness. We don't know for sure if this means that these people will forever be immune to contracting this virus and getting sick again. But for right now, it is showing some promise. So I think that's why that is being done, because the hope is that if you get these antibodies, this passive immunity, passive basically that you're giving them somebody else's antibodies and not allowing them to actively make their own. The hope is that you're going to decrease the severity and duration of illness. Okay. So that's what we're hoping.
That's actually good to know. And I'm going to read a little bit more about what's going on here on Instagram, their input. Michelle is saying that's what we have to focus on moving forward, which is, being in better health.
Right.
And somebody also said they're not disclosing what's happening with the Jewish people. And Kareem is saying, but we do know what is happening with us, and we've known too long. It is time for us to take control of us, like the Jewish people are doing. And people are just agreeing 100%. So with that being said, I know we don't have like a vaccine. Well, before I get to the vaccine, a lot of people don't seem to understand what herd immunity is about. And I think I was in the shade room and somebody was saying, oh, we should do herd immunity. No, we saw what happened 100 years ago when that happened. So talk to us a little bit about herd immunity and why that shouldn't, to me, I don't think that's a good option.
So we're saying herd immunity, hoping that other people have been vaccinated and hoping that other people have had some kind of active immune response to this virus. We don't know that. Not enough people have been tested. So herd immunity is basically when you're protected because the people around you are protected, right? So we
don't have a vaccine to even herd immunity anything right now, right?
Well, so that exactly, but I think also it's thinking, okay, maybe people have been infected, so now they have antibodies, they're protected, they're not going to contract it, so I won't contract it. We don't know how many people have this infection, so there is no way to really say, okay, you're going to guarantee that there is some kind of herd immunity if you don't get vaccinated. And I think that's another thing to talk about. There's a lot of when I talked about like lack of trust with us to authority, there might be some people that don't believe in getting vaccines. There's some people that don't vaccinate their children against the flu. You know, so it begs to say, okay, you're okay. Well, let's get the vaccine. Are you going to actually vaccinate your child? Or are you going to still think, oh, they're trying to track you and tag you and things like that? So I think that's why education is the biggest thing. And I think that's one thing that I learned when I was doing my master's of public health. Education. We have to educate ourselves. Yeah. There's nothing better than an educated patient. It might be annoying to your doctor, but it's best for you because you come in there and you say, I know myself and I know what's going on. And it doesn't mean you're going to doubt what your doctor is saying, but it just means that at least you have a voice for yourself and you're not just taking whatever the professional is telling you.
So not coming in with all that WebMD knowledge. You guys are
absolutely not. Dr. Google, we don't like Dr. Google. We do not support Dr. Google.
Right.
He didn't go to medical school, no.
Exactly. All right, so somebody's saying on Instagram, my brother is young and healthy and Haitian, doing all the Haitian remedies, and it's still taking more than a month to fully recover. Where are most people I see are getting better faster? I'm not sure if I completely understand what your question is, but are you saying that has your brother been tested for COVID and is positive and he's using Haitian remedies? You can elaborate on that. Does that make sense to you?
I think it makes some sense. So, it's one of those things that it's a catch-22. We're seeing healthy young patients that are dying from the COVID-19 virus. What we're postulating, what we're thinking is that it's a robust immune response that's causing some of that. We know that potentially this is playing a role with the development of the strokes that we're seeing in younger patients. Mm-hmm. It might be what's going on. There is no rhyme or reason right now as to what's going on. Normally, a young person shouldn't have this bad of an outcome. They should recover. They should rebound pretty quickly. But what we're seeing is that some young patients are having really poor outcomes. So it might just be a robust immune system that's doing that. And unfortunately, is a catch-22 in that regard.
And Kareem is saying, what has the majority been? You mean in the people that have been getting sick, Kareem, or the healthy younger people? Because I know one of the questions I had for you was, it's been causing stroke in in people 30 to 40 years of age. And that's something that they're still doing some research on. And my question about that was that is the stroke from the body's immune system trying to fight it off? Like, what could really be the cause in that stroke in a young, healthy person?
You're exactly right. We think that is what's going on, and like I've said before, I'm gonna start by saying we're not 100% sure, but it looks like that's what's happening. I talked a little bit about the ACE2 enzyme being in the lungs. Now, it's important to know that that same enzyme exists in the heart, it exists in the brain, it exists in the GI tract, like your intestines. It's also present in the endothelium. The endothelium is the lining of the blood vessels. What we're thinking is that virus is migrating to these areas and potentially causing an immune response. Now, you have a robust immune response coming into a place where they see a troublemaker. They're coming in there trying to take it out. What's instead happening is you're occluding vasculature. You're basically having clots that may be getting thrown at that point, and that might be leading to the strokes that we're seeing.
Oh, wow.
So it's very possible that that's what's happening. Until we have research, until we unfortunately have autopsies done on some of these patients, it will be very difficult to know.
Wow. That's one I think they really need to look into. So I see people over here on Instagram really going at it, talking about, and in a good way. They're talking about it's a disservice to tell Black people that diet isn't playing a main role in our health.
It's 100% playing a role.
Yeah.
It is. So when we talk about diet, we have to also focus on when we worry about lower socioeconomic neighborhoods.
Right.
The availability of stores that sell fresh produce,
right,
as opposed to having fast food restaurants on every corner.
Yeah.
Okay. So now there might be 2 grocery stores in the neighborhood. There might be a mile or 2 out.
Yeah.
What happens is that person that's hungry, there's a Chinese restaurant around the corner. Oh, there's a fast food restaurant around the corner. I spend $2, I get a meal. I might as well do that.
Right.
As opposed to getting on a bus, going to a store, spending $5 to get some grapes. You're only eating grapes.
Right.
You're not getting a full meal.
Right.
And how dare you buy a salad? Because those things cost like $10, right?
Right.
So it's absolutely important. And I think it all ties in. It absolutely ties in. You have things that increase mortality independently. The obesity, the heart disease, all of these things, with the exception probably of lung conditions, are related to poor diet. Sometimes genetics play a role, and we cannot control that. But when you have most of these things being caused by obesity and lifestyle choices, you automatically are increasing mortality in this population, and you give them something that is going to overwhelm their system. It's the perfect storm, basically.
Yeah. It's quite unfortunate, huh?
It is very unfortunate.
Yeah. So, speaking of unfortunate things, I know a lot of people with this whole pandemic, doctors have been reporting that people are reluctant to call 911 or go to the emergency room because of the pandemic. What advice do you have? If somebody is like really, really down and, at what point do we need to really go to the hospital?
Okay. So it's kind of twofold, right? I, as a physician, have told some of my patients, call us first. That's what we're advising patients to do. We're telling them, call your primary doctors, call your primary provider and say, hey, this is going on. What do you advise me to do? We are saying to call us because we don't want you to go to the emergency room. The emergency rooms they're inundated. They have too much to deal with right now. So if you're having a cough and you want to go into the emergency room, just don't do that, okay? So we're telling people to call us. We'll advise them on what to do. We're also saying to them, if you are having difficulty breathing, if you're having chest pain, the things that would have sent you to the ED correctly before this whole pandemic started, still go to the emergency room. Don't call me when you can't breathe. You can't talk to me. Even you can't catch your breath to talk to me. Don't call me at that point in time, because what happens is I have to now call EMS for you, and I have to find out where you live, et cetera, as opposed to you doing it by yourself. So we're definitely, it's twofold, where we're like, practice some, common sense and say, okay, let me call if I think I'm not sick enough to go into the emergency room. And also, say, if you feel like you're not doing well, go to the emergency room. Certainly.
Right.
Um,
And I have, and this is like a concern that I don't know if anybody else can relate to this, but for me, people that know me, you guys know that I have a brother with a disability, and he's nonverbal. And I've always
okay.
wondered, God forbid, anything were to happen, and he has to go to the hospital. They won't let anybody go with him. Um, and I know where he lives, his group home, they're trying to create some kind of, I guess, sheet to have available just in
Like a
case.
face sheet or
A face,
something.
right,
Mm-hmm,
in
mm-hmm.
case, if anything were to happen. So do you have any advice for, people that they have somebody elderly or somebody with a disability in their family and something were to happen like this COVID thing and they can't go to the hospital with them? Do you have any advice for that?
So I honestly think, from what I understand, minors are not being allowed in by themselves. They have to go in with a guardian.
Okay.
I would assume that somebody that's nonverbal will not be allowed to go in by themselves. They
Okay.
would have to allow somebody in the emergency room with them. That's just not. It's not possible to treat them.
Okay.
They can't get what's going on with the patient if they
Right.
can't talk to them, right?
Right.
So they have to be, obviously there are exceptions to rules.
Okay.
Minors are one. A minor can't speak for themselves. They can't make decisions for themselves. As well as somebody that's nonverbal. They have to have somebody that's somewhat of a conservator or somebody that has a power of medical power of attorney, something of that nature, that will have to speak on their behalf. So they have to be allowed into the emergency room with them.
Right. Yeah, Kareem, she just said, I'm sure you heard, she said nonverbal, they have to have somebody with them, just like a minor too. Yeah. So that's good. That's good to know. That puts me at ease because trust me, I've been thinking about that and like hoping. And I mean, granted, where he lives, his group home right now for the past month and a half, they haven't gone anywhere. They haven't gone outside. So good. I can't even go to see him. We've just been FaceTiming. So that's good. That's good.
That's good. Yeah.
So I've been wondering about that. So now I want to segue into scientists saying that it's not likely that we're going to get a vaccine soon. They're saying 18 months out. Again, it ties back to really what this is about. Besides this whole Zoom and Instagram Live is about. He's not sick, Kareem. I'm just praying nothing happens. Yeah. So besides washing our hands, wearing a face mask outside, I go running a lot in the morning. I have asthma, so I cannot run with a mask, right? It restricts my breathing in a way.
Significant, understood.
Yeah, so, and I know I read an article by the New York Times that if you are in some kind of motion, you're moving and the particles can catch up with you. I don't know. All I know is I honestly can effectively run with a mask.
With a mask, right.
And I know right now is a courtesy thing for other people because when people see me, people that can run with a mask, that's great. But when people see me coming, they literally almost cross to the other side of the street. And I'm okay with that. Please go wherever you need to go.
Right.
Any advice on being outside, working out, running like I'm doing without a mask?
Right. So just a little bit about the vaccine. So there's a lot of trials going on right now. Are they promising? That's still to be determined. One thing that I read somewhere was talking about giving the BCG vaccine. Now, the BCG vaccine is what's given for tuberculosis. If you came into the United States from outside of if you migrated to the United States, you potentially have gotten that vaccine. And the theory is that the body would mount an efficient immune response to help fight the COVID-19 virus if somebody does get infected with it. We don't know yet. Because I'm saying that because that vaccine already exists. So that's a potential that could be done. We're not sure yet. Research still has to be done about that. But as far as researchers that are novel to the COVID-19 virus, we don't know much as far as like when things are coming out. We know that there are volunteers that are volunteering themselves to be injected with the vaccines that are being tested. How they're doing right now, we're not 100% sure. Just speaking about running outside, it's not likely that these particles that are the respiratory droplets are staying in the air. So if you're running and you're not wearing a mask, there's somewhat of a peace of mind, I would say, that you're not potentially going to run into a particle. Obviously, if you're running in close contact with somebody that is sick, then you have a higher chance of it. But these particles are not just going to linger in the air. They're respiratory droplets. They will eventually fall to the ground.
Right.
But, with anyone that has asthma and exercise, I always advise my patients, use your inhaler before you exercise.
I do.
Basically, good. Because what we're trying to do is open up your airways so that you don't feel that tightness that will happen even regardless when you run. And, that's what we advise to do. So
I typically use my inhaler 15 minutes before I go work out. And I've had it since I was 12, so I'm a pro at it now, I guess. But
good. Good.
So Kareem was asking any prediction about when a vaccine is coming out.
There's no way to predict. We'll know as soon as something shows promise. What I think they don't want to do again is preemptively rule anything out, kind of like what they did with the Plaquenil, hydroxychloroquine. We've seen now that there's been almost a 50% more death rate in the people that use that medication compared to people that didn't. So I think there's definitely that fear of wanting to kind of make sure that things are right before you give a vaccine. Because the last thing you want to do is give people a vaccine and cause more illness or cause more side effects, more problems that are worse than an actual virus. And then you open up this kind of worms of, are vaccines really necessary? It kind of puts all of the vaccinations that we have in, on the line at that point.
So with your background in epidemiology, vaccines really take this long?
They do.
Oh,
they
wow.
take a while to come up. You have to basically either get a live vaccine with an attenuated, basically meaning like sometimes it could be a dead virus or a live virus. You have to make sure that it's not enough to cause a significant illness that's similar to the person getting the illness, but you have to make sure that it's stable enough to cause an immune response. Because that's basically what you're doing, so that in the event that somebody gets in contact with this, with that illness or that antigen, they can fight it off. They do take time. They do take time. It's none of everything. I mean, we've had vaccines for a long time now, and some of these illnesses, like polio, for example, are still being eradicated in some parts of Africa, of Nigeria, because of religious stigma, religious beliefs, and things like that. So vaccines have been around for a long time, but they take time to make. Yeah,
Kareem, I hope that answers your question, because Kareem was asking how and why are they saying 18 months? How do they come up with that?
Right.
Yeah. So I guess that answers the question.
It's also important to know, like, when is the last time we've really had a vaccine being developed in more modern times? I don't remember the last time a vaccine was developed in modern times.
Right.
Besides like the HPV vaccine, that's still changing. But they do take time to get made.
Yeah.
Absolutely.
So we're going to go into the questions segment. We have about 10 minutes before Instagram kicks us out. I think that's enough time. But if you have any questions for Dr. Ogbonna, please type it in. She's very knowledgeable. I've learned a lot in this little bit of time. Haven't you guys? They're saying thank you on Instagram. Yeah, I've learned quite a bit as myself. So if you have any questions, please type them in. Let me see if there's any question that I missed. I think I was able to. And thank you once again for tuning in, from taking your time out from your quarantine evening to join us.
One thing I was going to mention, which I thought was pretty interesting, most of these studies have been done about on African Americans, and not so much Latinos, but African Americans. We make up about 13% of the United States, of the population. But we, at this point in time, are responsible for 1 in 3 deaths. When you think about that, that's huge. Significant.
That's a lot.
34%. And what's alarming about that also is that we only have data from 40 states. 40. There are 50 states. So 10 states have not submitted their data, right? And one of those states, unfortunately, is New York. I will be very surprised to see what happens when New York submits its data. So right now we know 40. It's incredible when you think about that. When you think about 13% of the population is making up for 34% of people that are dying from this virus. So It's
Wow.
pretty interesting when you think about
When you
it.
break the numbers down like that, it's even scarier.
Absolutely. Absolutely.
Yeah.
Absolutely. I had to go back and read that a couple times. I was like, is this real?
Right.
But
And
it's
New
pretty
York
scary.
has not submitted their data?
New York is not one of the states. No.
That's
I think
interesting.
they have too much. They're doing a lot right now.
They're doing
Imagine if they start doing that data. It might be 50%. It might be 60% for all we know.
Wow.
It might be significant in New York.
And that's why we can't reopen yet.
Nope.
Yeah.
Okay.
Yeah. And Johnny's asking, are there concerns about traveling once the ban is lifted? I know for airlines, of course, we all know they've been hit. And for those that are still flying, I heard that is one person per row. And for an airline to fly one person per row, they might as well not fly at all.
Yeah.
So, yeah, there are going to be concerns, a lot of concerns. It's not going to be back to life as normal. We might not ever get back to that. Not anytime soon, at least. So, somebody's asking, have you touched on a drug that the president was pushing to take?
Plaquenil, hydroxychloroquine.
Yeah.
Yeah. So that medication basically, in Africa, in Nigeria specifically, it's used for malaria. If you've
Right.
been in Nigeria, you've taken that medication, right? In the United States, it's used to treat autoimmune conditions like lupus, rheumatoid arthritis, and things like that. I think that's why I said in medicine, science, things have to be vetted before they're done. There are multiple steps to research projects that are done, research on medications. There are multiple steps that are done. And there's long-term research looking at the effect of the medication. So what's happening right now is that, like I said, we've seen that there's been almost 22% mortality rate in people that were treated with the Plaquenil in addition to Zithromax, which is an antibiotic, and as opposed to 11% in the population that were treated solely with the antibiotic. So I don't really speak politics too much in public. I speak politics in private more often than not.
Right.
So I will just say that, yeah, that's a little bit of insight to that. I think right now a lot of physicians are not prescribing that medication to patients anymore, just because it looks like it's doing more harm than good. Because it's known to have side effects that are cardiotoxic, basically problematic to the heart. And, you know, you give that medication to a patient that already has pre-existing heart conditions. What are you doing?
You're talking about the same chloroquine that I used to get in Nigeria?
The same medication. Yes.
Okay.
Yes.
Speaking of chloroquine, back in Nigeria growing up, that it used to itch. Did they change that?
I don't know. I've never used the medication in the States, so I don't know, actually. That's a good question. I don't know if that's something that I saw as far as like, I'm sure they probably removed whatever it is that was causing that.
I hope
It
so.
gave you like that pins and needles kind of feeling when you took it. Oh yeah.
Yeah.
I remember exactly what you're talking about. Yeah.
All right. So, someone is asking, what necessary preventative steps should be taken given that states are opening back up?
Common sense. That would be the biggest thing that I would say. Go to the grocery store if you need to. Go to the park if you need to. You know, go do things that you need to do. But when it comes to luxuries right now, like getting your nails done, going to the nail salon, you know, things that you don't necessarily need to be doing right now, just try to still act like we're going through a pandemic, because we are, because people are still dying. And that means that people that have not contracted this infection will still contract this infection.
That's true.
It's not stopped yet because they opened outside.
Yeah.
So we just have to be aware of that, use common sense like we would with, at this time.
And Kareem is asking, what should Black and brown people do right now to be better, not normal?
Better in what regard?
Better in what regard, Kareem? You mean eating better, exercising, taking better care of our health? Let us know. And somebody's saying chloroquine still itches. That's not
So
good.
it still itches like mad. I see that. I see that.
Yeah.
That's good to know.
So while we're waiting for Kareem, last question, I want to ask you, please, wherever you are, clap for her, clap for her. She's done so good today. Please, a round of applause.
Thank you.
Thank you. This has been so informative. So I want to ask you, what's in store for you in the near future? Where can our viewers find you? What can we do to bring more patients to you. I don't know if that's a thing for doctors, but, where can we find you for more information?
So, I was talking to my husband recently when I got my master's in public health a while ago. I feel like I have not worked with that degree to the extent that I probably should. I think one thing that I want to do moving forward is get into more public health policy making. I think that's something that I enjoyed doing when I was getting my degree. And my hope is that kind of even on the local level, being able to get involved and do things that are that do some implementation in medicine. I think that's probably what I want to do moving forward. I'm still definitely doing primary care. It's my heart. It's what I want to do. I love family medicine because I see everyone. I see from birth to death. I used to deliver babies at a point in time.
Oh, wow.
Not anymore. So it's definitely my hope to get into more policy implementation and things like that. So that's what I'm hoping to do.
That's awesome. You guys should follow her. You see her hair is pink cocolette.
Yes.
Yes. Please
That's
follow
a very
her.
old Instagram handle.
Please follow her, and I'm sure she'll be glad to answer any questions if you DM her. This has been very informative. I feel like I need to bring her back for more because I don't think this is a 1 hour talk, but for the hour that we've been on here, it's been really informative. And again, I want to thank her so much. Everybody's saying well done on Instagram. Thank you. Thank you so much. And any last words for us? I mean, Instagram has given us a little bit of time. Anything? Wash our hands.
Of course, wash your hands, wear a mask. Even if you feel dumb doing it, wear a mask. Just pray. I'm hopeful that we will all make it out of this. I know that's not the reality, but I'm hopeful that we will get out of this and return to some kind of normal.
Yeah.
But just take care of yourselves. That's most important. Take care of yourselves and each other. Love each other.
Yes. Yes. That's it, you guys. Thank you so much.
Thank you so much for having me.
Thank you for taking time out, and I will love to have you back on the show again.
It would be my pleasure, for sure.
Thank you. Everybody's saying thank you, and thanks everyone. Have a great
evening,
and in my Ellen voice, love on each other.
Love on each other, sis. Thank you.
All right. Have a good night.
All right. Bye-bye.
Bye.